Hello, everybody. Hi, Dr. Phillips. How are you?
I'm good.
Good. I'm Sarah Chavez. I'm one of the owners here at kokuavida, and we have Dr. Bruce Phillips here, and he has two practices in Southern Indiana. He's been practicing for a little over 30 years. You're creating a wellness center in North Vernon, are you not?
Correct. Yep. We renamed ourselves Jennings County WellCare.
I love it. I love it. Dr. Phillips is one of the best. So sit back and get comfortable, you guys. I just want to let you guys know that nothing that you hear on here is medical advice. Dr. Phillips is just answering questions. So if you have any questions, always go back and refer to your doctor for any medical advice. Okay. So Dr. Phillips, today we're going to be talking about thyroid disorders. And I know I hear a lot of people struggle with thyroid. They're struggling with cortisol levels, whatnot. I know you know a lot about this subject, so I'm excited to hear what you have to say. But what the first question would be, these are just the top 10 questions that people ask about thyroid. What are the common symptoms if you do have a thyroid disorder?
Well, the the big one is fatigue. And people have energy laxes that they just can't get back into balance, and they really struggle to get going and stay awake and all those type of things. And there's fatigue is tough because there's a lot of different conditions that cause fatigue. But other things that you can look for is skin dryness. That would be a issue. So if your skin is changing, and you can also see some changes around the eyes. And a long-term thyroid condition, they say you'll get some thinning of your eyebrows and the lateral edges on each side of the eye. So just look for things that are changing. And you also can get uh, some changes in your vital signs. So maybe your heart rate will go down, maybe your blood pressure will go down. You might even notice that you will gain some weight, of course, and
That's
your
fun.
metabolism goes down. Um, so so all those things are things to look for when you're hypothyroid. Hyperthyroid, you get things like exophthalmos, where your eyes are protruding from your face and look a little more bug-eyed. Uh, you, of course, would have the opposite. You might be having extra energy and not being able to sleep and relax. You might be noticing that you're thinning out and you can't keep weight on. And another thing with thyroid too is you might notice changes in your desires to drink and consume water too. So all those things can be signs. And anything though, I remember going through professional school, and you're sitting there and you feel like, oh my gosh, I've got every one of these conditions that they're talking to you about. But you're a student, you're fatigued, you're you're burning the candle at both ends. And so the most important thing is just, I always tell people, a symptom is never a problem. It's just the indication that you have a problem. So go to a professional and figure out what the problem is, because you can be chasing rainbows and supplements and all sorts of things. And and it just frustrates the heck out of me when someone walks in with their grocery bag full of supplements, and they still feel like crap because they're trying to self-diagnose themselves.
Right.
And it just doesn't pay, because there's so many compilations of symptoms that match each other, and they go with other conditions, and you really want to get evaluated properly.
So don't go to Google to self-diagnose. So Dr. Phillips, how is the thyroid tested and diagnosed? So I know there are two different conditions, correct? You could have the overactive and the underactive. So how are those diagnosed?
Well, typically people test the thyroid hormones, okay, T3, T4 active, and free T4 flowing around in the bloodstream. But here's the challenge: is your thyroid can be working perfectly, but if you aren't converting T4 to T3 in the liver, then it's a liver problem. And so a lot of people have conversion problems, and it's not even a thyroid problem at all, but that it is expressing as a thyroid problem. And then there's other symptoms. You know, a lot of people will come in and you swear they're a thyroid problem. You take their blood testing and everything's normal. And so there are lots of things where the endocrine gland is doing exactly what it's supposed to do, but then the cells are not receiving the message. And so we call this endocrine disruption. And so we have so many chemicals in our environment right now that we have mimickers that get on the receptor sites and block the hormone from getting to the cell and telling the cell what to do. And so you'll test and you'll have perfect blood work, but then the physiology is still messed up because you have these toxins in your body blocking the receptor sites. And like I say, it's a condition of endocrine disruptors. And you've got to be properly detoxified to get those endocrine disruptors out of the body. I explain it in a couple different ways. So if you're at a busy parking lot and you're looking for a parking spot, and then all of a sudden you come to that parking spot where the person's parked crooked, well, there's a spot there, but you can't get into it. And so it's the same thing with these hormones. There's a spot there, but they can't get into it because these endocrine disruptors are blocking the spot. And so consequently, the hormone is there, and you're getting the proper feedback loop from the physiology because it's in the bloodstream and saying we don't need to make more thyroid hormone, and it's being converted, but it's not being received. So that's a huge problem. And I always tell people it's like when I'm watching, I happen to be a big college football fan, and if I'm really intently into a game, my wife can be talking to me and I don't get the message. Now she's talking and my ears work, but I'm not, I'm focused on the game, you know? So it's the same concept, you know, and people tend to get that analogy a little better.
Yeah, that's a good analogy. I think most men will like that analogy. So going back to what you said, Dr. Phillips, so if it's not a thyroid problem and it is something in the liver, are there what natural supplements could you take to convert T4 needs to go to T3? Is that what you said?
Yes. There's lots of good supplements that help the liver. Certainly, you know, some of our CBD oil helps detoxify the liver. It helps get rid of some of these endocrine disruptors that we've talked about. You know, there's tons of things. Milk thistle is a common one that's good for the liver. So there's lots of things that help the liver to increase in its functionality. Basically, everything that we put in our mouths and everything that's in our body, just about everything goes through the liver. So it's a very, very, very active organ. And so I tell people, you're really never wrong to support the liver.
That was my next question. Okay, in today's society with all the chemicals, I mean, we've got chemicals in the air, the water, the food. If I think about it, it keeps me up at night. Is it too much to take something daily to supplement your liver to
Yeah,
help?
right. It's not too much, but you just want to make sure you're taking it at like a supportive maintenance dose, not a therapeutic dose. And so many people, you know, when they read the label, they're like, oh, I should be taking 6 a day. Well, you should be taking 6 a day if you have a liver condition. You might only need 1 a day if you're just trying to maintain your liver and upregulate liver function.
Okay.
So just make sure you're doing dose appropriate support versus therapeutic, you know, trying to create a change in the liver.
Right. And again, you guys, like I said in the beginning, that's a question you can go back and ask your doctor, you know, if you're not sure how much to take. So, Dr. Phillips, I take iodine daily, and it has some, I moved it from my desk. It has, I think, selenium in there, and one other thing. So what role does iodine play in the thyroid? And is that a supplement that everybody should be taking every day?
Well, when we talk about the 4, T3, T4, that's how many iodine molecules are on that particular thyroid hormone. So thyroid is very high in iodine content. And this is kind of interesting because a lot of people get prescribed things like Synthroid, and most of the so if you remember, Sarah, I'm going to take you back to high school. If you
Uh-oh.
remember back to the periodic table,
Yes.
okay,
I do remember the periodic table.
okay, good. So we have this class of chemicals. You have the chlorides, the bromides, the fluorides, and the iodines, and I'm missing some, but you get the idea. So you have the halogens, okay?
Okay.
And within that, halogens compete with each other. So unfortunately, when you take something like Synthroid, it has bromide in it, and it is attracted to the thyroid gland because it's a halogen and it pushes iodine out. And so
Oh,
to detoxify the bromide, you've got to take lots of iodine and it will push the bromide out eventually. But if they're in equal amounts, the bromide is selectively more powerful than the iodine. And
oh,
so you've got to overpower the bromide by taking extra iodine,
okay.
and you'll detoxify the bromide out of your thyroid. But and that's that's information even a lot of the medical doctors they don't take into consideration. And another area of the body, especially important for females, that's very high in iodine is the breast tissue. And so most women will have like tender spots or fibroids in their breast, and even some cancerous masses in their breasts. And if they just increase their iodine, a lot of that will go away.
After what you just said, I will never miss a day again. I mean, you know the importance of supplements, but when I hear you say it like that, I'm going to put it back on my desk. That's my daily reminder to take it. Goodness sakes. So other than iodine, is there anything else? What did you, when I had a question about the water, Dr. Phillips, do you get more thirsty, or less thirsty if you have a thyroid condition?
Well, again, it kind of depends on where you are with hyper or hypo. So you need water to metabolize. And so as your metabolism goes down, you're probably going to desire less and less water, which would be hypothyroid. As your metabolism goes up, you're probably going to require and desire more and more water because you're
Um,
metabolizing more.
okay.
So
Okay.
water is a very important component of the metabolic process.
Okay, that's really good to know. So if somebody does suffer from the hypothyroid, then they should be conscious and make sure they're getting enough water because water helps flush toxins out of the system as well.
Right. And I always tell my people that are struggling with weight, it takes 2 molecules of water to burn 1 molecule of fat. So make sure you're getting your water in.
Oh, water and iodine, Dr. Phillips, you are just making my day good today. You make it sound so easy, but I really
And
think it is if you take care of yourself and you're aware.
and then another thing, you talk about daily liver support. Another easy thing that you can do is just squeeze lemon juice into your water, and that is a natural way to clean out and detoxify at a moderate level. It's not something that's gonna, rebuild cirrhosis of the liver or anything like that, but it's something that's gonna help maintain healthy liver function.
Oh, okay. I didn't know that. Lemon water as well. Here's my next question. I know this is
Okay.
a good one. How does stress affect the thyroid function?
Well, stress affects everything. It really does. And so, if you think about when you're stressed, are you more active? Are you getting good rest? Are you, making good decisions even? Are you alert and aware and vibrant and all those types of things? So it affects everything. And and it's interesting. I don't have the book handy, or I would share it with you. I'll try to make sure I have it for our next call. But it's interesting because some people have actually categorized, and I have a couple books that have done this, and categorize specific stresses that affect specific areas of our body. And
Okay.
so, if you are prone to, I remember this off the top of my head. So usually women that develop breast cancer, they have a past stress around nurturing. They either weren't nurtured or they struggled with nurturing other people, things like that.
Oh, wow.
And so there's these types of stress patterns that are associated with almost every condition that you can think of. And it's really interesting. And we do a technique in our office called bioenergetic synchronization technique, and it allows us to tease those things out so that we can neutralize those stress patterns and then optimize the healing potential because we've removed uh, the stress in the system. And so I always tell a patient that physiology should never change with a thought. So, if you're worrying about something and you get an ulcer, that's what we call a reactive thought. Your body is responding inappropriately
Wow.
to that thought. So it's fine to have negative thoughts, but you should be thinking, okay, this is a negative situation. What should I do? Or, what should I pray about? Whatever, you should
Right.
take action. It shouldn't be something that's causing a reaction in your body. It's something that should cause action in your life. And so the reaction is what we fix with the bioenergetic synchronization technique, because so many times we attach deep, deep, deep seated emotions and physiologies to these thoughts, and it creates interference patterns in our lives, and we can't heal optimally, or we can't even express ourselves optimally.
Oh my goodness. Preach, Dr. Phillips. That's fantastic. That is so true because we store everything.
We
And
do.
and I know stress wreaks havoc on the body.
Yes.
So,
So if somebody one time in your past told you, you'll never be successful. We'll just use that as an example. Okay. Now, if you just said, whatever, screw you, I don't believe you, you're a jerk, whatever, and it didn't land, you didn't allow it to stick, then you're fine. But if you're like, but I want to be successful, and I really admire this person, and they wonder why they think I'll never be successful, and now all of a sudden you're you're creating this recording, this subconscious recording in your brain and your subconscious. We call it SEMO, subconscious emotional memory override. And now you're overriding your potential and you're focusing on this limiting belief. And so now you've owned that. You've owned this thought that you'll never be successful. And now all of a sudden, every time you go to be successful, you're going to self-sabotage, because in the back of your brain, remember, you're never going to be successful. You can't be successful. It's going to stop you. Same thing with if somebody says, when you're a kid, you're never going to be skinny, or called you a fatso or whatever, and you owned that you're going to be fat the rest of your life. You're going to self-sabotage every time you try to diet, or every time you try to get healthy, or every time you try to improve in that area.
wow. That's really good. You guys listen, Dr. Phillips, you can book an appointment with him. He's like, I don't know, do you do remote sessions for energy, Dr. Phillips?
We do some, yes. As I transition from being in practice now 33 years, Julie and I are starting to talk about how our next phase of living in life is going to be. And so our goal is to be more virtual with our clients, and then have home health retreats. So the people will come once a year or whatever, however many times they choose,
I
and
love
we'll meet with them in our home, and then we'll take them through an experience of really deep diving into how to live their life based on the health challenge that they're currently trying to address. And we'll teach them, Julie mainly will teach them this part, how to eat well and how to prepare meals well. And then I'll teach them all the things that they should be doing supportively, and then get them started on their health journey and do treatments here in the house. And then we'll work with them virtually after that. So that's our goal in the coming years.
I love that. We need more doctors like you. Dr. Phillips, today has been fantastic. I was jotting down notes. I've always learned something from you. So thank you for today, and you guys will join us for next time.